Hello, this is Dr. Ahmed Al-Jaishi. What is the point of a great study if the message never lands with the people it is meant to help? A strong trial can fall flat if the right people do not understand it, use it, or act on it. That is where knowledge translation comes in. In this module, we'll look at how knowledge translation helps research move beyond publication and into practice. We'll start with what KT is and how it differs from dissemination. Then we'll walk through how to identify your audience, choose the right format, and work with partners to create and review useful materials. At its core, knowledge translation, or KT, is about turning research findings into information people can use. The goal is not just to share results, but to make them meaningful in practice. In simple terms, KT goes beyond "here's what we found" to "here's what this means for you." KT is different from dissemination. Dissemination is often broad, one-way communication, sharing what was found without tailoring the message. KT is more targeted. It considers audience, context, and action, with the goal of helping people understand and use the findings. Identifying your audience is the first step in the KT process, meaning who needs to know what and why. Different partners have different information needs, priorities, and decision-making contexts. Your audiences may include patients, caregivers, frontline clinicians, system administrators, policymakers, advocacy groups, and community organizations. They do not all need the same thing. A patient may want to know how a treatment affects daily life. Clinicians may want practical guidance on implementation and clinical decision-making. Administrators may focus on resource implications and operational feasibility. Policymakers may care about cost, scalability, and system-level impact. Advocacy groups and community organizations may be looking for information that is directly relevant to the populations they serve. Once you know your audience, think about their context. What decisions are they making, and what barriers might shape how they use the information? Then ask rather than assume. A simple question like, "What would make this useful for you?" can help you focus on what matters most. The next step is choosing the right format to deliver the message. Different KT materials work better for different groups, so this is really about matching the message to the audience. For example, one-pagers are often a strong option for busy administrators because they are concise, easy to scan, and simple to circulate in clinical or organizational settings. Infographics can be especially effective for patient education. Their visual format can make information easier to understand, more engaging, and more memorable. And for decision makers, policy briefs are often a better fit because they can clearly define the issue, summarize the evidence, and point toward practical recommendations. There are also other channels that can be just as important. Slide decks can work well for clinical teams because they fit naturally into meetings, rounds, and training sessions. They help present information in a structured way and open the door for discussion. Social media can be useful when the goal is broader public awareness, but the content needs to be adapted to the platform, whether that means keeping it brief, more visual, or easier to share. And community forums or Q&A sessions are especially valuable when you want two-way dialogue. They give people a chance to ask questions, clarify concerns, and provide immediate feedback, which can also help build trust and make the research feel more relevant to community needs. Choosing the right format is important, but so is the language within it. Even a well-designed KT product can miss the mark if the wording is too technical. The first step is to remove jargon. For example, instead of statistical significance, say the difference was likely not due to chance. And instead of adverse events, say side effects. Second, use the active voice whenever possible. It usually sounds more natural and is easier to understand. For example, patients reported improved symptoms is clearer than improved symptoms were reported by patients. And third, keep the structure simple with clear headings, short paragraphs, and bullet points. If visuals help, keep them simple and accessible. Another practical part of KT planning is making sure you have the resources to do it well. That means budgeting time and money early, not treating KT as something to figure out later. The knowledge translation process often involves more than people expect, including design, layout, translation, printing, distribution, and engagement with partners or stakeholders. The point is simple. If KT matters, it needs real resources behind it. Once you know what you are creating and who it is for, the next step is building a realistic timeline. That means planning when each material will be developed, reviewed, finalized, and shared. The timeline should include more than just the drafting stage. You need time for internal review, partner feedback, revisions, formatting, approvals, and then distribution through the right channels. It is also important to build in partner and stakeholder review time early, not as an afterthought. Their input can help you spot gaps, improve relevance, and avoid reworking materials at the last minute. The goal is to create enough space for collaboration, refinement, and a smoother rollout overall. Once your materials are out in the world, the job is not finished. You still need to pay attention to reach, engagement, and use. Are people seeing the material? Are they engaging with it? And most importantly, are they actually using it in a meaningful way? It is also important to get feedback from the people you are trying to reach, so you can tell what is working and what is not. That gives you a chance to refine the content, adjust the format, or change how the material is delivered. Over time, that helps you improve your approach as needs, contexts, and opportunities change. As we wrap up, it is worth highlighting a few common mistakes that can weaken even well-intentioned KT efforts. The first is waiting until the end. KT needs to be built into the study from the start, including the design, timeline, and budget. The second is trying to create one-size-fits-all materials. A single document for every audience is usually too broad to be truly useful. Different groups need different messages, formats, and levels of detail. A third mistake is not leaving enough time to gather and incorporate feedback. If partners or users say something is unclear or unhelpful, that is valuable information. It is much better to adjust early than to keep moving forward with materials that are not working. Another common issue is overloading materials with data. More information is not always better. In most cases, clarity and relevance matter more than completeness. It is also easy to underestimate the importance of follow-up. Sharing something once is rarely enough. People may need reminders, updates, or opportunities for discussion before the message really lands. And finally, accessibility cannot be an afterthought. If materials are not accessible because of language, literacy, format, or technology barriers, then some audiences are effectively left out. So in the end, strong KT is not just about creating materials. It is about creating the right materials for the right people in a way that is useful to them. Thanks for joining me for this module. If this was useful, please like the video and subscribe to the channel.